Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, retinopathy of prematurity, if you see the pathogenesis or pathology of retinopathy of prematurity, here there is actually number one, there is a preterm infant, there is a preterm infant. Number one, there is a preterm infant who is exposed to oxygen concentration. Once the preterm infant is exposed to oxygen concentration, there is development of excessive free radicals which inhibit the spindle cell migration, producing angiogenic factors resulting in retinopathy of prematurity. So this is the pathogenesis of retinopathy of prematurity. So because of the angiogenic factors, there is increased blood vessels are formed.
thank you and thank you for watching.